strongest point that we have at St. Joe's, that I think we have at St. Joe's, is that we're family oriented in our care, and the support that new moms and dads will get here in bringing a new life into the world is wonderful. We have a welcoming area downstairs, so we have a dedicated parking spot for the parents. So middle of the night you're driving down here and you're not sure where you're going to park. A dedicated parking spot, you come through one set of doors and you're there. You're in the welcoming center. That's where we'll first evaluate mom and see where she is in her labor and what's going on with her. And then as she's ready to come up to labor and delivery, she'll be brought up here, be put into a room. She'll be greeted by one of the nurses, labor and delivery nurses, who will come in and then start the process with her and explain to her, you know, here's kind of what the course of events are going to be, as well as asking her, what are your expectations? What are you wanting in your labor process? Because every woman comes in with a different idea of what, you know, kind of a preconceived, it's kind of like vacation. I'm going to go to Hawaii, I, you know, anticipate this, that, or the other. Somebody else might, you know, anticipate a totally different trip to Hawaii. Same thing's true with labor. They'll come in with, and we want to hear what their expectation is right at the very beginning, and we want to try to meet those expectations when they're here and go through that process. When you have a new baby and particularly if it's your first time experience, you get bombarded with information and options. Options about vaccinations, options about, you know, putting antibiotics in the eyes, things that will happen. They take a lot of time to really walk through with patients here and explain why we do that, why we recommend doing that. And it's always ultimately the patient's decision on whether they want to do that. So it's an information overload really at the beginning. And so we try to ease that process and make you feel as comfortable with going home with that new baby as you can possibly be. The intensive care nursery here has just outstanding track record. I can't say enough about, you know, what a wonderful facility that is. The fact that you do the most deliveries of any hospital in the state, that brings the smoothness to critical events. So it won't be as rare to see something here as it might be at another facility because we do so much. And so when something comes up and you say, oh, we had this same event 2 weeks ago, it's comfortable. The staff is comfortable with it. They deal with it, you know, day in and day out. That's probably the strength of being the largest OB hospital. That again scares people sometimes in the thought that they think, oh gosh, it's so big, I'm going to get lost in the shuffle. The exact opposite. It's a comfort zone. Would you rather have a pilot flying your plane who flies once a month or a pilot who flies daily? I'd rather have the pilot who flies daily, you know, who's doing it frequently. We offer a lot of classes here, including a class that we started years ago, the Daddy Boot Camp, which is a wonderful program for dads, because, you know, we focus a lot on the moms, and the moms have books about, you know, what's going on with their body and what's happening to them, and here's this dad who's sitting on the sideline saying, I'm going to be responsible for this baby also when we go home. And so we started a program years back called Daddy Boot Camp, and it's our boot camp for dads. It's a wonderful program that helps them. So why St. Joe's? Bottom line, we do more of it than anybody else. We do it well, and a mother is going to have her best chance at a wonderful outcome at this hospital.